Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
I've been having back pains for many years, probably for too much playing tennis and soccer. I do have arthritis. I know that in all of my joints. I've had surgeries in different places, but it's progressively getting worse every year. In winter time, it gets really painful and locks up quite often. If I stand up too much or I sit down too much, it locks up. And I have to do a lot of stretching, a lot of inversions and
So you do inversion
decompression to relieve that pain. Because sometimes I can't even walk straight. I can't keep my back. It just
so you're walking like forward.
Yeah, back. Yeah.
Forward. So how many years have you been experiencing back pain?
I would say at least 20 years.
20 years. So for the 20 years, what kind of treatment, who doctor you saw, and what the recommendation?
I've seen plenty of doctors. Usually they give me anti-inflammatory to relieve the inflammation, and also sometimes painkillers if it gets too bad. I try to use again inversion table, and I've seen some specialists. They've taken MRIs, X-rays, the whole thing.
What they found?
They found a bulging herniated disc.
What level?
Between L4 and 5.
Okay.
That requires surgery to relieve the pain.
So they recommend surgery. How many surgeons recommend surgery?
3 of them.
Oh, so you went to 3 surgeons and all the 3 recommended surgery.
They all did, and one of them told me, listen, if you can take the pain, I wouldn't do the surgery because there's no 100% relief. You know, it might not be 100% effective.
Nobody guarantee 100% effective.
Exactly.
Yeah. So current symptoms, what kind of symptoms do you experience? Do you have sharp shooting pain to your legs?
Yeah, now that the weather is getting warmer, it's not as painful. It's more stiffness in the morning. But in the winter time, when these pains come, I have shooting pain down my left side, sometimes numbness. Sometimes I can't even feel my foot. I can't walk, put any weight on it, or it just gives away. And sometimes I have shooting pains right down my leg. And even, tingling sensations. And
you feel it in the whole lower extremity, or
yes,
you feel it in your feet?
It starts from here, from the side, all the way, especially here in the hip. That 90% of it is probably in the hip, and then it starts shooting down sometimes.
So how much pain from 0 to 10? 10 is emergency room, much worse.
When I have the sharp pains, it's probably 8, 8.5.
What about now?
Now it's probably maybe 1.5, 2.
So we're gonna do the motion that aggravate your symptoms. So you let me know how much pain with this motion. Reach to the floor. And tell me, and mark on your legs how far you can go. So really touch your legs. So you
knees locked?
Yeah. How much pain from 0 to 10?
Probably 3.
Okay, backward.
It's my hamstrings.
My hamstrings are tight. Yeah.
Very tight. Left side, right there.
How much from 0 to 10?
About 2.5.
2.5.
2.5, 3.
So twist left and right. That side bend.
There's some pain there, about 3.
Okay, and the other side. Do you have sharp shooting pain or just localized in the back now?
Just localized in the back right now.
Okay. In the morning you said, or when it's cold, you start to have the sharp shooting pain.
Yeah.
Twist.
Some, about 1.
Okay.
Not bad at all.
Okay. So I'm gonna have you do squats and tell me how that feels.
Squats.
So you're gonna bend your knee and try to go down. How's that? And up.
On the back, it's not bad. It's my knees that hurt.
And your knees that hurt. Okay. So the worst motion was like forward and twisting.
Yeah.
Okay. All right.
And everywhere they operated, this arthritis was just eating up my joints.
So, but you don't have. It's an osteoarthritis. It's not rheumatoid. Yeah.
Yeah.
Okay. How's it feel?
Good.
It's okay.
It's not painful.
Okay, make sure it's not painful. So. Okay. Have you had any abdominal surgery?
No.
Sorry if I pulled you here. me know if it's too much, okay?
Okay.
How's that feel?
It's okay.
Okay. Make sure you breathe, okay? So, when you feel it, show me the line where it goes down. So here,
There.
okay, and going down,
Goes down right there.
and there, and going down to the side.
Like that way I can.
Yeah.
Sometimes right there.
So this is the line here.
Yep.
Okay. Okay. And you sit here. Make sure you don't wear any wallets in the back here, okay? Period. Nothing in your back pocket, especially when you sit, okay? How's that feel?
There's pressure there. I feel it.
As long as you don't feel pain, that's fine.
I'll let you know if there's pain.
Pressure is okay as long as there's no pain. So when it goes down to the side.
Uh-huh.
Okay. So your artery might probably tight too. Okay. Like the body should get rid of the excessive scar tissue. So when the body does not get rid of it, that could compress on nerve arteries, on your vertebra, pushing on your disc, could make it worse. That's a scar tissue. Feel those knots here?
Yeah.
Okay. Do you guys want to feel the scar tissue, or are you okay?
I have plenty.
You
I
have
felt
plenty?
it before. Yeah.
Okay. So it's you can see even like redness where he has a scar tissue. So it's all around this area. You feel this knot here. That one. Feel that?
Yeah.
Is that painful?
It's not painful, but I definitely feel it.
Yeah.
It's
Have like a
uncomfortable,
little
but it's
rock
not
here.
painful. Yeah.
Yeah, make sure it's not too much what I'm doing, okay? Because I want to know if you have inflammation, and I don't want to cause inflammation. So if you feel pain with the treatment and we push the pain, that might cause inflammation and make it worse.
Yeah.
We don't want that. We want to just work on the proliferation stage only. Feel that?
Big time.
Sorry. Yeah. Okay. Well, it's not too bad actually. I had patient had sciatica. They had a tennis ball size of scar tissue here. Everybody was taking images for the back. Nothing wrong in the back, but they did not look at the scar tissue that pushing on the nerve here in the glute area. So yeah, but this is not too bad actually. That spot.
I pulled my hamstring, I don't know how many times.
On the same side here?
On both sides. I pulled both hamstrings at least 7 to 10 times each one.
Wow, man. You're really rough on your body. You're very competitive when you play sport, yeah?
I used to be, yes. I mean, I played collegiate.
Wow.
I still play till this day.
Yeah. As long as you don't feel pain, just stay active, okay? But if it's aggravate your symptoms, take it easy. You might want to do like swimming or something like that just to be easy on your joint.
That's what all my doctors say. I'm like, okay, I'll be in the casket if I'm gonna stop playing sports.
Yeah. Is that too much here?
No, it's fine. I mean, you're right on there, on that knot.
You feel that?
Yep.
That's a big one here. Feel it. That's right in here. Do you guys see this? You see it's jumping here.
Yeah.
Here. It's just a stuck. It's not really going a straight line. And it did this way. Yeah. Sorry, is it too much?
No, it's
And you
good
see-
pressure.
You see the redness where he has the scar tissue.
I'm gonna have to send you my daughter. Maybe she can learn her techniques.
Yeah, sure. I have online courses for healthcare provider and here.
Yeah, I've had left Achilles injury last summer.
Right in here, yeah?
Yeah.
That's where you have a lot of scar tissue here. So your body, probably when you get injured, you can build the scar tissue, but your body's not really breaking much. Okay. So,
Huge difference.
Hmm.
Oh my God. I don't feel anything anymore here. And I can go
Nice.
down probably lower.
Mm-hmm. Let's do the twisting, and we'll have you step forward a little bit.
The pain was 3. It's probably 1 now. I mean,
Let's drink a little bit more water.
there's hardly ever any pain left.
Mhm. Drink more water. Do you drink enough water? You're not fasting today, are you?
No.
Okay.
Well, I would do 1 meal a day, weekdays.
Beautiful, good job. We'll go over that with you. Backward. That's further. That's a lot
Much,
further.
much further.
Yeah, that's good. Down. Let's mark on your legs how far you can go down. That's good. You were mid leg.
I'm probably about 4 or 5 more inches.
Yes. Any pain or it's gone?
There's, I wouldn't say pain, discomfort.
Where?
Um,
And
Same
with which
area.
motion?
pretty much same area.
Mm-hmm.
Yeah. So I can't even pinpoint it anymore.
Okay, let's drink more water. Because sometimes it takes like a few seconds. And your body gets used to the release and the range of motion. Let me know if you feel it, okay?
Yeah, more to the center now.
It's a center,
More to the center now.
not on the side.
Not on the side anymore. I used to feel it more on the side, but now
Okay.
it's more located to the
How
center.
much from 0 to 10?
No more than 2. Towards the center.
It's a
But
center.
Maybe 1.5.
1.5. Okay, what about bending forward? How's that? That's good. You down to your
It's
ankle.
more hamstrings.
Hamstring
Than
tightness.
Yeah,
Hamstring tightness, both of them or one?
both of them.
I was focusing on this side only, and well, we'll do the other hamstring.
Good.
Yeah. See that?
Yeah.
And let's cut this here too. Too much?
No. I'm just breathing out.
Okay, that's good. So I'm trying to work only on the proliferation just to make sure it's purely proliferation, not inflammation. You see, if we get you to 0 now, it's purely proliferation. That 0 to 10.
1.5.
Okay.
0.
Okay. Backward.
Probably 1.
Okay, so
No more
one.
than 1. It's
Okay.
much better though than before.
Bending forward. Look at that. You're almost going to your toes. Beautiful. Good.
Yeah.
Good. Okay, so I'm gonna do.
Go back up without minimal pain.
I'm gonna work a little bit on the inflammation. Do you have seizures?
No.
No. So that's what I'm gonna use to work on your inflammation. So if you have mild inflammation, it should take a minute with this magnet, and that's enough. Okay. If it's moderate to severe, usually I recommend patient wear it, like put it in a,
Belt or something.
Yep, walk with it, because it's gonna take a little bit time for severe inflammation. For herniated disc, if you're pain from the herniated disc, that's what I give to patient to wear it. It penetrates 2 inches to 2.5 inches, and that helps with decreasing internal inflammation.
Yeah, and I used to wear my magnetic bracelet because of my elbow issues. Used to help.
This is like extremely strong magnet, so you don't want to have any electronic closer to it. So and I coat it with anti-inflammatory coating, so that's usually work a little bit faster. How does it feel?
Good.
When you felt it in the center?
Yeah, it was
Okay.
towards the center. Left side of the center. Yeah.
Okay. Okay. So drink a little bit more water and try it again. How's that?
There's still some pain, but
0 to 10?
mild. Maybe 1.5.
Okay.
No pain.
Okay.
Significant discomfort, but no pain.
How's that? You're going further now. Look at
Much
that.
further. Yeah.
Yeah,
And
it's a
there's
lot
no
more.
pain, just discomfort.
Okay, so let's do this, okay? Because we know you have arthritis there. I'm gonna put the magnet in the back, okay? So, and I will have you do the motion and tell me if your pain gone when you have the magnet. Let's pull this up a little bit. I just want to have the magnet on the spot. Is that on the spot?
Mm-hmm.
Okay. Let's do the motion again and tell me how that feel.
So we're going back.
Yeah. How's that? With the magnet on.
Excellent. No pain, nothing.
Okay, we'll just do the
Not even
side.
discomfort.
Yeah, that's inflammation. That's good. You're going further this way, actually.
No pain.
Okay.
Just discomfort.
Yeah. And we'll have you bend forward. How's that?
Very good.
Can you tell the difference when I put the magnet on it?
A little bit, yes. There's an improvement.
Improvement. So that's the arthritic part that we need to work on with the magnet. That's usually I recommend to wear it for several hours a day, depending on how bad is the inflammation. Right, so you had it for 20 years now, we just did ASTR treatment. Can you tell any difference?
Major difference.
What's the
My
difference?
flexibility, my pain level, the tightness.
Uh-huh.
It's not as tight anymore. I mean, I have more motion.
Mm-hmm.
And it's more like, instead of the pain, it's more of a discomfort,
Mm-hmm.
tightness.
Just
but,
the
but I'm
tightness.
much looser. I can feel more flexible.
That's nice. Awesome. Thank you.
Thank you.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.